Hello, everyone. I'm Sheldon Baker, your host for Healthy Bytes, brought to you by Innovision Health Media. My guest today is Dr. Brad Bellard, a board-certified sports medicine physician at Common Spirits, the Sports Center. He has served as a physician for multiple professional sports teams, including his current role as assistant team physician for the Denver Broncos and his prior role as assistant team physician for the Dallas Mavericks. Whether working with elite pros or everyday fitness enthusiasts, his goal is to help active individuals safely accelerate recovery, break performance plateaus, and optimize their physical health. In his clinical practice, he utilizes cutting-edge regenerative medicine and minimally invasive procedures that help patients avoid the burden of surgery and return to the lifestyle they enjoy. Dr. Bellard, good having you on Healthy Bytes.
Thanks for having me, Sheldon.
Every NFL season, we watch athletes perform at what I think are superhuman levels. However, their biggest secret is not how hard they push themselves on the field. It's how they train, protect, and recover their bodies behind the scenes. So as a team physician for the Denver Broncos, you work directly with elite athletes to optimize performance and prevent injury in the field. How do you do that?
Loaded question, Sheldon, but I'll tell you just kind of from a 30,000-foot view, we're dealing with high-performing individuals. Let's just put it that way. People who are extremely motivated to perform at a high level for multiple reasons. And you really kind of hit the nail on the head. For most people who are high performing, I think the mentality is, if I can just continue to work and work and work and work harder, then I'll be able to achieve my goals. And that's partly true. It's not entirely true. But at a certain level, you really have to start working smarter and not necessarily working harder. So, our goal is to be able to have athletes, at the highest level that we take care of, such as the Denver Broncos, but also our active patients that are in the clinic, to be able to optimize their performance by not only, hey, let's work out and work out hard, but let's also make sure that we're recovering. And so one of the biggest tips, one of the biggest pearls that we really educate on is your rest and recovery is just as important as your workout. Because what can easily happen is just that mentality of work can easily turn into overuse, injury, fatigue, and so forth. And so with those type of people, high performing individuals, we're really convincing them that, listen, your rest and recovery is not taking away from your overall performance. And so by including rest and recovery at strategic times, then we can actually improve performance. So rest and recovery is actually part of your performance plan and not taken away from it.
So based on what you just said, you have to be an expert in rapid and advanced recovery.
Absolutely. Absolutely.
Everyday fitness enthusiasts can drastically improve their results and avoid chronic injuries by adopting 3 specific NFL caliber habits at home. Share those habits.
Yeah, so one I would say is you got to have a plan. Okay. You got to have a plan. So one of the things that I encourage, some of our listeners or people who are viewing is instead of really trying to do this on your own, see a professional. You don't have to do this on your own. So, get some help, some guidance so that you can have a plan, because without intention, it's just not going to work. The second thing I would say is make sure that you take full advantage of recovery. Here's what I mean by that. If there is a hard, high intensity workout, and oftentimes we measure intensity based on heart rate, okay? So if the heart rate is really high for your workout and you're spending a significant amount of time in your workout at a high heart rate, and it's a really exhausting workout, the following day cannot be at the same intensity or can't necessarily be working out those same muscle groups in the same way the following day. So, for example, if someone has a really heavy lifting and high intensity leg day on Monday, Tuesday cannot be a high intensity leg day again. Either we need to switch body parts and do something upper extremity that's more focused on upper extremity, or if we're going to do something lower body, we could do something called active recovery, which is, yes, the legs are moving, but not nearly at the same intensity as what they did on Monday. So maybe they could do a light jog or some biking that's not nearly at the level of what they did prior to. So, so recovery is going to be the second one. And the third one I would say is listen to your body, right? This mentality of no pain, no gain, we can kind of fall into trouble. I make a very significant distinction. So there's a difference between having a burn when you work out versus my joint is hurting while I'm working out. And every time I'm going to work out, it's not recovering and getting better, but it is still hurting. So a burn and being sore after workout, that should get better. But if your joints are hurting every time you're working out, you should see someone and get professional opinion on what's going on.
Why do some teams have a preponderance of injuries?
Yeah, again, loaded question. I can tell you this. I think one of the things that we're seeing just overall, particularly when we're looking at NFL, and I think we're even seeing it in the NBA, is the soft tissue injuries. Okay, and what I mean by soft tissue is your muscle strains, your hamstring strains, your calf pulls, Achilles tears, and things like that. One of the things that contributes to that is just overall exposure, Sheldon. So part of what we're seeing is that people, by the time they get to a professional sport, they've done so much exposure at a young age that by the time they get to be professional, some of our athletes already have joints that are probably older than what their actual age is. And so we believe that particularly in youth sports, some of that is contributing to that because people get funneled into sports at such a young age that, again, it's just amount of it, it's just a certain level of exposure that happens over time. So by the time they get to that level, they may be at a little bit increased risk just because you got a little more tread off the tire, if that makes sense, some wear and tear. The other thing that I think that may contribute to that is, depending on the staff, is just making sure that there is a targeted, customized plan for each individual player. If somebody has some tendonitis, if somebody has some, for example, like an Achilles tendonitis, their training should not include a bunch of running, and jumping for their training, but we need to try to preserve some of those reps for the actual field. They can't do the same training as someone who doesn't have Achilles tendonitis. So it needs to be very customized and individualized according to what injuries that people have as they're lingering throughout the season. It needs to be customized. And listen, I can't speak to what's happening in other people's locker room. I can only speak to what we do, and that's really how we focus on it. Is really customizing each person's training and recovery plan.
Any thoughts about nutrition-based healing?
Well, nutrition is important. Saying nutrition-based healing, I mean, at the end of the day, nutrition is part of healing. It's not necessarily a thing to say, hey, if you need to have nutrition-based healing. We just know nutrition is important. At the end of the day, when people are doing workouts, particularly resistance-based workouts, we're breaking down muscle, Sheldon. So we need the building blocks in order to fuel and build up that muscle again. So if someone's breaking down muscle in a workout, we've got to refuel and put the protein in. If we don't have the protein in, then sure, we may have done a good job of breaking down the muscle, but do we have the building blocks to build it back stronger if we don't put enough protein in? If we're doing a endurance-based workout and someone doesn't have the carbohydrates, which is our initial fuel that the body's going to use, that the muscles are going to use whenever someone's doing an endurance-based training. Well, if they run out of fuel, they're going to get fatigued. And then if they get fatigued, the easiest way to be able to introduce injury is to have fatigued muscles. So nutrition is key to making sure that athletes have enough fuel to do what they need to do, but also to recover, to build that muscle back and put the energy back that they used.
You know, last year I had the chance to interview Marvin Washington, who played on the Denver Broncos Super Bowl team, Super Bowl 33. And for a while now, he's been very much an advocate of players using cannabis or CBD for pain. Your thoughts about that?
So ultimately, we will use, different things. I would say it's probably not the first thing that we want to try to use. Most of the time, if it's regarding pain relief, if something hurts, first of all, we want to figure out what's going on. Let's get a diagnosis and then treat appropriately with just some of the things that are in our normal toolbox, right? So, can we use ice? Can we affect how what we call their biomechanics? Can we help so that the joint's not hurting as much? So physical therapy where they're not going to hurt as bad. Can we do different injections that are safe for the athlete? Some of those injections could include a cortisone injection just to decrease inflammation, and anti-inflammatory injections to decrease inflammation. And so those are the things that we're typically using. I couldn't tell you that it's going to be the primary thing that we use, because if something's hurting that bad, we gotta get to the bottom of it. And if we start extending out more toward, CBD, I'm not saying it's not useful, but it's certainly not one of the first things that we'll use. And if it's getting to that point, we really got to figure out what's going on.
I would imagine mental conditioning is also a key to certainly remaining focused at all times and maybe even kind of blocking out pain.
Absolutely. Each person's different. It's amazing, Shelton. I can take care of two different individuals with the same issue, and people may be recovering or improving at different rates. And I believe it's multifactorial, but it is without a doubt that the mental aspect that there is a mental component to healing. I was having a conversation with another doctor the other day, and we were agreeing about how it's interesting. I can't say that I'm batting 1,000%, but we can almost predict who's going to get better just based on the mindset that they have coming into the injury or coming into the procedure or post-surgery. So mindset has a huge influence on healing.
Last question is not a health question, but is Denver going to win the Super Bowl next season?
Great question. Another loaded question. I would say we're certainly going to do our best. As a medical team of physicians, I'll tell you, it's interesting. Most people probably don't realize how much we have an effect on games being won or lost. Now, Sheldon, I'm not sitting here saying we're the reason why they go to the playoffs or win the Super Bowl or not. But with a team of physicians, with a team of the medical team for a professional team, when they're in alignment and taking care of these athletes really well, we can shift whether it's a divisional win. One or two wins may be as a result of the care that's being put by the physician staff or by the medical staff. Even a swing of 3, maybe even 4 games, depending on what happens. And so the guys that I work with, the other physicians in our practice at the Sports Center and Common Spirit, Dr. Mayer, Dr. Mates, Dr. Gennario, our team, fantastic. And so we're going to do everything that we can to swing a few games that'll be in our direction to hopefully be able to get to the Super Bowl and win it.
Well, win or lose, good luck to you in this coming season.
Thanks, I appreciate it.
Dr. Bellard, thank you very much for joining me today on Healthy Bites.
Awesome. Thank you for having me again.
And thanks to all of you for watching Healthy Bites.